I'm going to talk today about a condition called Bell's palsy, or half-face paralysis, or we call it facial palsy. It was described by Dr. Bell because suddenly it appears and the patient all of a sudden cannot move either right or left side of the face. Their eyes are somewhat paralyzed and distorted. Their mouth is, the patient is unable to talk properly or drink. The water sips end up by leaking out of his side of the mouth. And it happens unknowingly to the patient. The patient wakes up, he develops that condition and say, what happened to me? A lot of times patients think that they have had a stroke, but it is not a stroke. Bell's palsy or facial palsy is due to a certain inflammation to the facial nerve and or what the surrounding of the facial nerve. The facial nerve is called the seventh cranial nerve. We call it cranial because it comes from the brain through the skull and exit, and it branches like that into the face, or like that, and it comes from behind the ear. Now, if there is any inflammation near the opening where this nerve goes through in the base of the skull, that inflammation will impact on the nerve, and as a result of that, the patient develops some sort of paralysis, or the innervation of the muscles is incomplete and incorrect, so therefore the muscles doesn't function properly. A lot of patients have twitching as well of the eyes like that, or the mouth, or the lips, and so on and so forth. Or they can't keep smiling. When they smile, it doesn't, the mouth is not even, and so on and so forth. Now, the most common etiology or the cause of that is either a flu or a virus, or similar to maybe a herpes virus or a common cold virus. Another cause, you could have had what you call middle ear infection, or you had the respiratory tract infection, especially sinusitis. A lot of patients develop that after a flight, after they've been on an airplane, and there is a change of atmospheric pressure from high altitude to a lower altitude, and vice versa. And that usually, most cases like that are reversible, and they take about a week or two or so, and the condition reverses itself. It's self-limiting, and actually you will have full function of your face. There are only rare conditions that these patients do not recover, and they continue on having that deficit of their facial structure, the twitching, the pain, the eyes, they are tearing, they lose a little taste sensation of the tongue, of certain tongue tasting qualities, and it is irritating and quite bothersome. Not to mention the disfiguring of the patient's face as well. In the past, there are a lot of surgical procedures as well as medical procedures. The simple thing is to take anti-inflammatory, to take maybe cortisone tablets to reduce the inflammation, and you will be well on your way to full recovery. There are only the ones that are persistent to whatever you take, it does not relieve it. You end up by having a permanent deficit or distortion of the face or twitching, and you end up by inability to drink properly, because the drinking, you're always leaking either on this side or that side, depends on the side of the face that's affected. So many doctors, and there are surgical procedures, they go and do a surgical procedure to go and open the space where the nerve exit from the skull, or they relieve the compression if there are inflammation, ligaments that are constricting the passage of the nerve. However, in my experience, I've been dealing with patients like that for the past at least 7 to 8 years. I use stem cells on them. It actually regained the function of the nerve as well as the muscle, and they have complete recovery of their motor function, their nervous function of the face and the muscle. They stop twitching, the eyes feels normal, and they're very happy. If I am able to change that deficit that is distorting one's looks and face, I think I've done a great benefit for that patient, and all my patients have been very happy with the results. Some patients need more than one set of treatment to be able to have full recovery. I had a patient, for example, with a history of facial palsy or Bell's palsy for over 15 years. This particular patient was very difficult to treat and took about 3 sessions of my treatment to have her corrected completely. Now, I harvested the stem cells. You ask me, where do you get the stem cells? We get the stem cells from the own patient's adipose tissue or fat. Fat stores the largest amount of functional stem cells and useful, and it actually regenerates the nerve damage that had occurred, as well as relieve the inflammation of the muscles and the nerve that happened due to the disease. I hope you enjoyed what I had to mention for you, because just distortion of the face is not very pleasing nor comforting. Meanwhile, I avoid doing any surgical procedures because it takes enormous amount of problems, and as you know, to just the idea of having surgery is problematic, then the recovery and etc., etc. And you can never give a complete comfort, and it takes as you know, if I can do it without surgery and I can achieve a good result, why not? Thank you.